Yes.
Yes.
So, Dr. Vincent, please.
Okay, thank you. Hello everyone, my name is Vincent. I am a hospital practitioner at Maison Alfort National Veterinary School in France. And I will present to you two cases of omasal laminae hypoplasia that we encountered in our facility. We faced our first case on the 4th of November 2016. The patient was a 30-month-old red Holstein primiparous cow, and according to the farmer, the first symptoms appeared about 15 days before arrival. The patient initially suffered from abdominal distension, then aborted at around 7 months of pregnancy, and she kept on losing weight and presenting intermittent dysorexia. Upon arrival, we were confronted to an animal in a poor condition. She was wasted, dehydrated, and clearly in pain. She had a severe tachycardia, complicated with a really loud heart murmur. She also presented a generalized abdominal distension and tympanic resonance, which was more severe in the right quadrant. Rectal examination revealed mucus-covered feces in scarce quantity. At this point, the main hypothesis was a right displaced abomasum with a volvulus secondary to transport. The heart murmur was consistent with an interventricular septal defect. Considering the critical state of the patient, we immediately performed a right flank laparotomy. And the abdominal exploration was confusing, to say the least. Abomasal volvulus was promptly dismissed, but the abomasum was indeed dilated, overburdened, and displaced on the right. The abomasum was nowhere to be found, meaning that the collar separating the omasum from the abomasum had vanished, and the typical harder consistency of the omasal content just wasn't there. The abomasum was deflated, but the overload was still massive. We tried to perform an abomasotomy, but with no avail, since it was impossible to lift the organ to the surgery site, which was just too heavy. Since no visible surgical solution was deemed possible, and considering the critical state of the patient, the animal was put down. The autopsy was performed first thing in the next morning by myself. And NECROPSY confirmed the clinical findings about the heart, revealing an interventricular septal defect of around 3 centimeters in diameter. And once the digestive organs were on the ground and prior to their opening, the omasum and the abomasum were as one large unique viscus of the same consistency. The neck, separating them, was wiped by the distension. The four stomachs and the abomasum were all extremely distended by the same pasty, yet still runny, fibrous content. 120 liters in the rumen, 30 liters in the omasum, 20 liters in the abomasum. The opening of the abomasum revealed a chronic active ulcerous abomastitis with large grade 2 ulcers almost perforating the wall. The opening of the omasum, finally, revealed the absence of leaves that normally fill the lumen and define the organ. We hypothesized that the condition was of congenital origin. In conclusion to this case, we attributed the critical state upon arrival to a right displaced abomasum due to transport, associated with latent distension of the gastric compartments and complicated with abomasal ulcers. The pain, dehydration, and septal defect all collaborated to put the patient in such a critical state. In the farm, the symptoms were attributed to a functional pyloric stenosis due to the conjunction of an abnormally thick digestive content and of abomasal ulcers. Now, was this all initially due to a lack of trituration by the omasum? This is a question, great question, that we will ask ourselves later in the discussion. The second case was presented to us on the 6th of December 2016, so around 1 month after the first one. The animal was a multiparous 5-year-old Holstein cow. It had been addressed to us for a chronic condition which started more than a year before arrival and consisted in weight loss and diarrhea. The symptoms, according to the farmer, were non-responsive to treatments, although treatments were not told to us, and were stable throughout the course of the disease. Upon arrival, we were confronted to an animal in a very, very poor body condition, suffering from an unremarkable chronic diarrhea. The vital constants were all within normal range. Our main hypotheses at this point were paratuberculosis, chronic gastrointestinal infestation, and chronic renal failure. In order to investigate this hypothesis, the following tests were conducted. A paratuberculosis serology, which was negative. Proteinemia was within normal range. Urine analysis was normal, and a fecal egg count revealed no parasitic element or whatsoever. At this stage, and after 2 weeks of hospitalization, considering the wasted state of the animal, we decided to put it down, hoping to find some answers at necropsy. Well, at first, necropsy was disappointing, to say the least, showing no macroscopic lesion on the serous part of the organs. The opening of the intestines revealed an aqueous, slightly fibrous content in every segment, as well as a discrete ileitis. Later, microscopic examination revealed a subtle eosinophilic infiltration. The opening of the stomachs revealed a pasty, yet still runny, fibrous content in the omasum and in the abomasum in normal quantity. And of course, necropsy was dominated by a hypoplasia of the omasal laminae. The leaves were all greatly reduced in height, with a mixed distribution, the longer ones being on the great curvature of the organ. At microscopic examination, the overall organization of the omasum was respected, with muscle fibers in the center of each leaf, which were clearly hypoplasic, and with surface papillae being also hypoplasic, even aplasic sometimes. Again, we hypothesized that the condition was of congenital origin. In conclusion to this case, we had no evident or easy cause to explain the chronic weight loss and the diarrhea in this animal. On one hand, the eosinophilic ileitis wasn't deemed severe enough to be held accountable, especially to explain the abnormal digestive content in all intestinal segments. On the other hand, necropsy was clearly marked by a hypoplasia of the omasal laminae and of the omasal papillae. Could these lesions have been responsible? If so, how could we have proven it? Well, in my opinion, to link the omasal lesion with a chronic diarrhea, we should have evaluated the fecal particle size. Indeed, we could have expected large fibrous straws in the feces with omasal dysfunction. Unfortunately, we did not perform that test, unfortunately. Therefore, we could not take the leap and conclude to an omasal dysfunction responsible for the chronic weight loss and the diarrhea. To discuss about this condition, because now we have to discuss, and since I had never been confronted to this kind of conditions before, nor my colleagues, nor any veterinarian in any French faculty that I could talk to, I wanted to compare our cases with previous case reports and see whether or not our findings were consistent with what had already been described. The first description I was able to find was the one made by Theodore Kitt in 1905. The anomaly was then described irregularly across the century. I recorded around 20 mentions or reported cases of it in the literature. In Switzerland, Germany, of course, Italy, France, the Netherlands, Japan, and Brazil. And in a lot of races, Holstein, Normand, Charolais, Black and White Frisian, Limousin, Brown Swiss, Friulana, and Japanese black cattle. Now, what kind of symptoms were reported? The first order of symptoms, and the most logical one, considering the severity of the malformation, includes growth retardation, chronic bloat, sometimes ruminal drinking, systematically in younglings with a small omasum and necropsy, as you can see on the picture. The second scenario, including case 1 of this presentation, manifests itself as a functional pyloric stenosis in young adults without growth defect. At necropsy, the omasum can be small or distended, always with an abnormal content in quantity and quality. The third category concerns young adults also. The condition was a lucky find at slaughter, the omasum being of normal size and the only suspected symptom being less feed deficiency during growth according to the farmers. Finally, the last group of symptoms concerned the second case described in this presentation, which could not be fitted in any previous group. The condition was diagnosed at the postmortem evaluation and was never suspected when the animal was alive. This is because there wasn't any, I insist, any history of digestive problem during growth or during successive lactations in this animal. The hypoplasia was associated with chronic weight loss and diarrhea, associated only. Although most of these symptoms are quite understandable, considering the severity of the lesion, It is really surprising in scenario 3 and 4, however, that the cattle could grow and produce without any signs of digestive problems. Indeed, although the role of the omasum is not completely elicited, it seems like a consensus has been reached on 4 of its presumptive functions: the transport of appropriately sized feed particles from the reticular rumen to the abomasum, the gastric groove closure, the fermentation of the ingesta, the absorption of water, volatile fatty acids, and minerals. In scenario 2, a lack of trituration by the absence of laminae omasal could explain a progressive distension of the abomasum and of the omasum. In scenario 4, the wasting process might be explained by a lack of fermentation of the ingesta and by a lack of absorption of volatile fatty acid due to the loss in surface, in itself due to the lack of laminae omasal. As for the diarrhea, we can only speculate, fortunately, that it might be linked to an impaired water absorption and to an impairment of the trituration process, allowing too much fiber to reach the intestinal content and thus creating a maldigestion syndrome. Do these findings allow us to conclude on how important the omasal laminae is? How important the omasum is in the economy of a bovine animal is clearly uncertain. The fact that a quite extensively damaged or malformed omasum may be found in an apparently healthy animal may indicate that it can readily adjust itself to such malformation or damage. On the other hand, the complex structure of the organ and the fact that hypoplasia of the omasal laminae is, in most reported cases, associated with serious clinical symptoms and death, indicates that it is a rather important organ and that interference with its functioning might be just a matter of time. Our first case report is consistent with the ones previously described in the literature. Our second case is different. Although we could not conclude on a causal inference, it still is, to our knowledge, the first documented case of hypoplasia of the omasal laminae in a fully grown, multi-pause 5-year-old dairy cow with no history of forced stomach disease. We might mainly have speculations about these cases, yet they were so surprising and are so rarely described that I thought they had their place in this Congress. Thank you very much for listening. Thank you very much to the organizer for giving me this opportunity and for the overall organization of this event. Thank you.